this will be posted to YouTube. But one of the questions we've been getting asked a lot in our Nimbus patients is, okay, I've hit my goal weight with GLP-1 therapy. Now, what do I do? And there's a lot of different things that we can do in this regard. And what I wanted to talk about is just some of the things that you should consider and possibly implement if you haven't started implementing that along your weight loss journey. Number one is nutrition. As we talked about in the ebook, that having a higher protein intake, so 0.6 to 0.8 grams per pound, depending on your goals. I prefer higher protein intake. I do 1 gram per pound, but one of my goals right now is to put on as much muscle mass as I possibly can as I get older. That can help with satiety. And the second thing as far as nutrition is prioritizing your fiber. So most Americans do not intake enough fiber. I think the average is around 12 grams, something like that, where the recommendation is 28 grams for women, 35 grams for men, or 14 grams per 1,000 calories. So with your nutrition, prioritizing fiber, prioritizing protein, and prioritizing whole and minimally processed foods. We know that people tend to overconsume calories when most of their dietary intake is ultra-processed foods. There was a really cool study, I think it was Kevin Hall, I think is his name, who looked at people consuming mostly ultra-processed food and unprocessed food, and they found that the people eating mostly ultra-processed food, and this was in a metabolic ward, so they were in a very controlled setting, ate about 500 more calories per day. So maintaining your calorie intake is really important because that's how the GLPs work, right? The GLPs work by increasing satiety so you don't eat as many calories, and you lose weight when you burn more calories than you are eating. And we talked about that in one of the other Health Club episodes. I broke down all the things that go into the calories inside of the equation, the calories outside of the equation. So protein, fiber, hydration, all of those are very, very important. There's more nutrition tips in the ebook. I would suggest looking at the ebook, but as you continue on in your either weight loss or weight maintenance program, if those are things you aren't doing in your nutrition, those are things that I would recommend. Then you're going to need to do, if you are looking to lose more weight off the medication, some type of caloric restriction, whether that is something like time restricted eating, so eating during a set fasting window, or intermittent fasting, something like the 5-2 intermittent fasting program where you do normal eating 5 days of the week and then 2 non-consecutive days you eat 500, 600 calories. That's usually around what the studies do. And that helps as your form of restriction. That's how you restrict calories. Some people do it at every single meal. They're just like, well, I'm just going to eat 10% less or 15% less or something like that. The other thing that you can do is limit food groups. Some people, like myself, one of my forms of restriction are that I really limit my intake of sweets and ultra-processed foods. That helps me control my intake. I also do once a week time-restricted eating on Sundays. So I'll do about a 20-hour fast on Sundays, and then that helps me control my calorie intake. But you've got to find out what works for you. If you're wanting to continue on your weight loss journey off the medications and see what you can do without them. If you are wanting to maintain where you're at, we can see what happens as we titrate down the dose. We'll talk about that more later. But there has to be, if you're wanting to lose weight, there has to be some form of calorie restriction. There's a lot of different ways to skin that cat. That's something that we can talk about later, but it's something to keep in mind so you don't go back to over-consuming and overeating food. The GLPs really do seem to help with food noise, and I can really empathize with people who have food noise. I think about food all the time. I love eating. I get a lot of hedonic pleasure from chewing. So I think about eating all the time. And I really empathize with people who have that. I have enough willpower through training, meditation, fasting, all the things I do to be able to resist that urge. Or if I do have that urge, I know I can get something like a handful of nuts or popcorn and maybe like a piece of dark chocolate. And that really helps. So you've got to find out what works for you in that regard. Exercise. If you aren't currently doing aerobic and strength training, we talk about that in the guide, how important that is for your overall health and longevity and well-being, for mental health and physical health. That is something that's essential for helping you maintain your weight loss or continuing on your weight loss journey. We have very good data that shows conclusively, in my opinion, that when people lose weight, those who keep it off, or people who are better able to keep it off if they are engaging in routine workouts. And that's been shown with diet alone in weight loss. It's also recently been shown with the GLP-1s that people who exercise were able to maintain more weight loss after they stopped the medications. So there's so many different ways to get in aerobic exercise. I know a lot of people don't like strength training. You have to work on your muscles to maintain your muscle mass, improve your strength. So what the current guidelines recommend is at least 2 days a week of strength training, 150 minutes of moderate intensity exercise per week, 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise per week. More is better. We're actually going to roll out some stuff in our Nimbus Healthcare app to help you with that, to help you with tracking your overall calories. So how many calories you need, plus also tracking your fitness. So that should be coming out here soon. Of course, we have more in the guide about talking about exercise and different exercise routines, whether it's full body, whether it's what we call bro splits, chest and tries, back and bis, that kind of thing, or whether it's upper lower splits, which is what I do. For our purposes, as far as strength and overall health and well-being, there doesn't appear to be much difference in the data. Just pick which regimen that works for you, and it might be a little bit of trial and error. I started off doing full body, and then I did the bro splits, and then now I do upper lower splits, and I found the upper lower splits allow me to lift heavy, and I still recover in plenty enough time. And by heavy, I mean more like intensity. I'm lifting with pretty good intensity right now, and just trying to maintain my muscle mass. Something else you can do is work with a nutritionist, work with a coach, work with a specialist, right? We have all kinds of resources in this day and age, and I put in the ebook some people that I personally trust that you can work with if you feel like you need a little bit of help in this area. There's nothing wrong with reaching out to someone for help, reaching out to an expert for help. The ebook that we have it's not personalized, and there's no coaching there. So it's just guidelines. And if you feel like you need coaching, that can really help you. If you have problems with your relationship with food, highly recommend coaching for that, to help you develop a healthy relationship with food. You shouldn't be thinking that, oh man, I ate this Snickers, I feel so bad, I'm off my diet plan, I'm off the rails. No, I eat Snickers, I eat donuts, I eat pizza. It's all part of the plan. And it's all because I have a healthy relationship with food. Of course, those aren't where I get most of my calories from in a day, and I make those occasionally because they don't sit well with my stomach. But I don't feel bad or feel like I've lost something or tarnished my reputation or goal or anything like that. So having a healthy relationship with food is very, very important. How you look at food, how you treat yourself. Of course, we talk about mindset in the ebook, treating yourself with dignity and grace and giving yourself compassion. Super, super, super important. Okay. So I'm a lifestyle guy. I always like to start off with the lifestyle things. Of course, moderating our stress is very important. We tend to eat more if we're stressed. I think everyone knows that. You don't even have to read a clinical study to know that we tend to eat more when we're stressed, and we tend to eat things that are higher in calories and sugar and fat and salt, all of those delicious high calorie density foods when we're stressed. And also getting proper sleep is very important. There is data that show that people who are sleep deprived tend to eat more calories the next day, and also in line with stress that we tend to make worse decisions when it comes to all things in life when we're fatigued and tired. So That's important. If you haven't worked on those things, or if you're starting to work on those things, continue that work. What I tell people, have that Kobe mentality. If you've ever seen the famous interview with Kobe, where they're like, are you happy that you're up 2-0? And Kobe looks pissed. And he's like, is job done? No, job's not finished. So your job is never finished. Continuing to work on yourself, continuing to sculpt yourself, to mold yourself is so important. Even if you are at your goal weight or your maintenance weight, don't think just because you've hit that you don't have to do anything, that you don't have to put in any more work. The work needs to continue with the things that we talked about. You've improved your health. You've improved your life. Continue to invest in yourself. Continue to reap those health dividends. Okay. So what about dosing? What should we do? So if we reach our goal weight and we want to try coming off the medication, what should we do? Well, we titrated you up. We need to titrate you down. I don't recommend just coming off the medication cold turkey. I recommend titrating slowly down and seeing what happens. We come down a notch and see if we gain weight or maintain weight or continue to lose weight if you're still wanting to lose weight. And then, okay, reevaluate in a couple months and then do it again. Reevaluate a couple months and then do it again. So we come down gradually. And then if we see that we get to a certain level and it's like, oh, my weight started to change again, and then we can investigate, see what's going on, see, hey, are we doing this stuff in the ebook? Come in the Nimbus Health Club, talk to us. You can get advice from myself, not medical recommendations, but things to just kind of think about and maybe discuss with your Nimbus physician. So that's one thing that we can do. Some people are going to be able to titrate completely off the medications and maintain where they are. Some people are going to need to get down to what we call in pharmacology the minimum effective dose. What's the lowest dose that maintains your weight in the range that you want it to be in? That's a principle all throughout pharmacology. We all learn that as pharmacists, minimum effective dose. And if you're someone who really struggles with the food noise, then that might be something that we have to do, is we just get down to a minimum effective dose and go from there and monitor and that is what it is. And maybe we try at another date to taper off. Maybe, if you hadn't done, examine your relationship with food, work with somebody to get that in check. And now you do that. Okay, maybe it's time to try and titrate down a dose after that. Or maybe you weren't exercising before and you start exercising. And so we can see with that. And maybe once you're consistent with that, we can titrate a dose down. It's the same thing with sleep. Same thing with your overall nutrition pattern. Same thing with all this stuff in the lifestyle things. So it's not an exact science. The dosing schedule is pretty much what was outlined in clinical trials. But, being a compounding pharmacy, we can kind of do things a little bit differently. We can try other doses as we come down to see where we go, what can we get to, what is the maintenance point for you. And then, like I said before, if we're not doing some of these other beneficial things, maybe we can start seeing improvement and we can come down. Mindset and mindfulness, that might be something, and I don't know of any data on this. I don't know if any data exists, but for me, whenever I started meditating, and this is anecdote, this is my personal experience. Like I said, I don't know if there's any data on this. The being mindful and doing more mindfulness has really helped me control that food noise. And I don't know if that's something that may work for you as well. So this has been an overview of kind of the thought process from a medical side, from our side at Nimbus, what to do if we are approaching our goal weight, or if we want to titrate down on the medications. What should we do? What should we think about? What are the things to keep in mind as this process happens? So feel free to come into the Relevant Weight Wise channel and the Discord to discuss with us and see if there's anything that we can do to help you along on that journey. Of course, always feel free to reach out to your Nimbus physician. Thank you for your time and attention. Have a blessed day.